Hello everyone, Randy Moore here with MSK Masters and PRP Masters. Just a quick little video here to show you some pre and post ultrasound images of the patient's rotator cuff, the supraspinatus, that was treated with Biocellular. And this is really with proof of the pudding, as we can show you pre and post images to show you the efficacy of ultrasound-guided treatments within regenerative medicine. As I said many times, the relationship is inseparable. This is just a classic example of we had this patient come in just today for a follow-up treatment, or follow-up examination, I should say, and it was quite remarkable what we saw. So these are pre and post images on a patient treated with Biocellular therapy. In this particular case, it was adipose-derived stem cells combined with platelet-rich plasma. Tendinosis, as I've said many times, it's the #1 pathology that you're going to find with tendons, and it's important that you know how to pick up on that, and that comes from understanding your sonoanatomy and then learning how to identify normal versus abnormal ultrasound anatomy. So here is the there we go. Had to advance the slide there. These are this is an example of two normal images of the supraspinatus. One in short axis, the top image up here is the tire on the rim view, which is what you see being demonstrated in the photograph and the anatomic diagram over here. But this is the humeral head, this is the hyaline cartilage, and from here to here is the uniform homogeneous presentation of the hyperechoic supraspinatus tendon in short axis probe orientation. The bottom image is the long axis view of the supraspinatus insertion onto the greater tuberosity. Bony landmarks always going to allow you to do the imaging in an efficient way, also to do reproducible images from one patient to the next. Bony landmark here is the slope of the greater tuberosity. Little dip in the cortical margin here, that's the anatomic neck, and then the convexity you see here as we go to the left or proximal on this image, that is the humeral head. And here you see the normal tapering conformity of the tendon inserting onto the bone, the linear anechoic tendon footprint. So that's our normal views here. Next slide that we have is going to be the here we go. Next slide is going to be the pre-treatment images. This image was done in April of 2024. This is the short axis, again, tire on the rim view. You can see obviously the loss of uniformity, irregularity of the humeral cortex, actually a little osteochondral lesion. But this is, again, the advanced tendinosis of the supraspinatus tendon. Here we see an oblique, kind of diagonal articular side defect or tear going through the supraspinatus tendon, almost a full thickness tear. This is a follow-up image that we just got today, February 2025. Look at the difference in the cortical margin of the humerus. The hyaline cartilage interface is well maintained. Now you can see the uniformity, the integrity of the supraspinatus tendon is much improved. Actually, the patient says she's in absolutely no pain at all and doesn't even think about her shoulder anymore. She actually originally hurt her shoulder in a skiing accident, so she's back to doing everything that she loves to do. So that's a short axis view, pre and post. Here's the long axis view, pre and post as well. So here we see in the pre-treatment image in April of 2024, slope of the greater tuberosity. Here you can see the anechoic defect within the tendon at the insertion, obviously not giving us that nice tapering contour that we saw in the normal view. This is the image that we got today. Again, look at the changes in the bony contour. This is, in my mind, just incredible what we saw here. But anyway, so now you can see this is some residual calcific tendinosis within the substance of the tendon here. It's just what we have left over. But look at the remaining substance of this tendon at the insertion, the uniformity of the fibers. The remodeling is just fantastic.